You mentioned non-operative options. Can you walk through some of those options that perhaps we could be exhausting before we look at surgery?
Absolutely. So things that we could look at is optimizing your health. So your activity level. Motion is lotion for the joint. So an arthritic joint will not get better with rest. It actually will get worse. So maintaining some activity in your life is really important. The assistive devices, a cane, a crutch, or a walker of some sort can help. That's a big step for patients, though, and it's something that you have to take a long consideration before going to there. It is something that's important for stability. If it does get to that point, the last thing you want to do is fall because of a painful joint. So if its stability is an issue, then definitely an assistive device is warranted. We talked about the advantages of weight loss if that's needed, and that kind of ties into what we do for weight loss. Why we look at weight is really the risk and complications associated with the surgery afterwards. So if your body mass index, which is not a great way of measuring your level of obesity, but it is the tool that we have. A BMI over 40 is a 20% increased risk, and a BMI over 50 is a 40% increased risk of infection. And infections are a main complication that can have a serious effect on your life. And so usually if that weight is not optimized, we set a goal, and I try to be reasonable, and there's been multiple studies that even if we're not able to reach that optimal BMI level, a 20-pound weight loss makes it a big deal. That does go a long way to reducing those complications.